So, in my opinion, there's several pressing issues when it comes to public health and specifically environmental health. The water crisis in Flint. Not only am I a Michigander, but I live not even an hour from Flint. And the issues that they're having have come right into my own city, state, and area here in Ann Arbor, Michigan. So the water crisis is a big issue. Um, the opiate epidemic is another large issue, and then health disparities of vulnerable population. But the one I want to talk more about tonight is the opioid epidemic. So in the early 1990s, pharmaceutical companies began to market opiate prescriptions as a pain reliever method that doctors could prescribe in the office, that hospitals could prescribe for patients going home after surgery, and dentists could provide after oral surgery. Pharmaceutical companies told doctors that the prescriptions were non-habit forming and that they were non-addictive. We now know that that's not true. Over the past 20 years, prescriptions have been dealt out widespread, causing both misuse of prescription and non-prescription opiates. Um, in 2017, the current administration declared a public health emergency because at this point, data has indicated that from 1999 to 2017, more than 700,000 people have died from a drug overdose. The opioid epidemic affects individuals, it affects communities, it affects populations, cities, governments. Currently, the rise in incidence of newborns born addicted to heroin is very similar to what we saw in the 90s of infants born addicted to crack cocaine. In 2017, this administration declared the opioid epidemic as a public health crisis. What that means for us is that under this plan, $900 million was invested into the opioid epidemic and the 5-point opiate strategic plan. That plan improves access to prevention, treatment, and recovery support. That includes opening up more treatment facilities in certain areas. That also includes providing long-term treatment for those folks that have become addicted, as well as the medically assisted treatment. It also will target the availability and distribution of overdose reversing drugs such as Narcan and buprenorphine, and provide medically assisted treatment or medically assisted treatment in areas. It also will strengthen the public health data reporting and collection as well as surveillance, which is something that's necessary so that we can target those hardest hit areas and make sure that treatment beds are available. It will also support cutting edge research on addiction and pain management, which is necessary because one of the issues that comes in place with the opiate epidemic is that when folks come off of the opiates because the doctor are taking them off, they begin to go into withdrawals. And so having some support services in place for folks to go to will be helpful. And then to advance the practice of pain management. So how do we, once we get out of this opioid epidemic that we're in, how do we make sure that we remain out of the opiate epidemic? That concludes my thought process on the most pressing issue of the opioid epidemic. I thoroughly enjoyed this class and can't wait till next week when we start the new one. Have a good night.